Hello, my name is Ashley Ball. Today's presentation will focus on patient satisfaction measures and how focusing on keeping patients happy can have unintended costs. In this presentation, I will discuss the following objectives. Describe unintended negative effects of acceding to the patient's request in pursuit of higher patient satisfaction scores. Discuss the inadequacy of the hospital consumer assessment of healthcare providers in system survey, otherwise known as HIM5370. Discuss how satisfaction surveys can be improved by reflecting active patient participation in patient-provider communication, and the importance of educating the patient on managing their medical information. In 2012, providers at the University of California, Los Angeles Health System were faced with a dilemma. Providers determined that a patient was in good condition to be discharged to a rehabilitation facility for continued care, but the patient was refusing to leave. In order to keep the patient happy, clinicians decided to postpone the clinically appropriate discharge. The following scenario is an example of overshooting, where doctors provide unnecessary care or services that do not improve the patient's overall health and increases spending, but clinicians willingly give in to the patient's demands due to the excessive focus on higher patient satisfaction scores. Furthermore, due to clinicians wanting to provide patients a positive experience, they are inclined to give in to the patient's demands, but healthcare professionals are learning that even if the patient is requesting unneeded care, it's in the best interest of the patient to set certain boundaries. Patient satisfaction responses make up 30% of hospital scores under CMS's Hospital Value-Based Purchasing Program, which either increases or decreases a hospital's overall Medicare reimbursement by 1%. In a 2012 study posted by the Archives of Internal Medicine, hospitals with high patient satisfaction scores were linked to greater inpatient care use, increase in healthcare and prescription drug spending, and high mortality rates. The linkage between patient satisfaction scores and increased healthcare services stemmed from providers' desire to accede to unnecessary patient-driven treatments in order to please public and private payers. Some providers feel improving patient satisfaction may be counterproductive to the efforts made to improve quality of medical care or lower spiral healthcare spending, thus showing a disconnect between improved patient satisfaction and healthcare quality. The Hospital Consumer Assessment of Healthcare Providers in System Survey is a standardized survey instrument used by the federal government to measure patient satisfaction on the care they receive during their hospitalization. The survey consists of 29 questions that measure 19 critical aspects of hospital care, such as care transition, responsiveness of hospital staff, discharge information, and overall rating of the hospital. Hospitals treating Medicare patients are required to report survey results to CMS. The exam has remained constant since its implementation in 2005, but providers feel it's time for the survey to be updated. Due to the scores being linked to reimbursement, HCA-HPS scores have improved overall, but some clinicians are seeing quality of care and patient experience indicators move in the opposite direction, leading various healthcare officials to question the validity of the exam. CMS patient satisfaction data was reviewed by Modern Healthcare, a leading source in the healthcare industry for important healthcare events, which showed that hospitals and physician groups with high scores show only a modest improvement in one patient outcome measure, readmission rate. Furthermore, HCA-HPS does not have any specific provisions that tailor to preventing overtreatment, which increases hospital costs, potentially harming the patient's health. Instead, determining how to improve the patient experience is left up to the providers that's caring for the patient. HCA-HPS 2012 survey communication questions were limited in measuring whether dialogue occurred between physicians and patients, whether the patient perspective was understood, or whether providers allowed them to share and the decision-making regarding their care. Quality communication could keep clinicians from overlooking important health problems and encourage patients to take an active role in their care. Measuring communication is one of the most cost-effective ways to use patient satisfaction in order to improve the quality of care delivered. On the current slide is a screenshot of questions taken from the 2019 HCA-HPS survey. The updated 2019 questions show more focus on patient-provider communication, with emphasis on listening, patients understanding the information that's being conveyed to them, and incorporating patient preferences into their medical care. In order for patients to be more active participants in their care, it's important they understand their medical information. To have the best clinical outcome, you need to have compliant patients. Therefore, it's important that patients know how to access their medical record. Patients that know how to access their record, that understand the information in their record, that can compare their information from year to year and compare results to see if they're getting better or worse, are able to be more involved in the decision-making process regarding their healthcare. In conclusion, providers acceding to patient requests for unneeded care in pursuit of obtaining higher patient satisfaction scores can have unintended negative consequences, such as overtreatment and increased healthcare spending. As a result, patient satisfaction scores show a disconnect between the level of patient satisfaction and quality of care given to patients. Therefore, providers must strike a balance between improving clinical outcomes and maintaining costs while still providing positive experience for patients. Here is my reference slide, and that concludes my presentation. Thank you.